It's very hard to summarize, all the meeting in a few sentences here. Very exciting data across the board: prostate cancer, testicular cancer, urothelial cancer, kidney cancer. There were some definitely highlights and practice-changing data. I will focus very briefly on a few examples. For example, in advanced urothelial cancer, we saw data from the EV301 trial. Professor Pauls presented the data from this practice-changing study showing overall survival benefit with Enfortumab Vedotin compared to single-agent taxane in US or Vedotin in Europe. Hazard ratio 0.70 for OS, hazard ratio 0.61 for PFS, cementing the role of Enfortumab Vedotin in these pretreated patients in the third-line space of advanced urothelial cancer. At the same time, as I mentioned before, we're very excited for other antibody-drug conjugate like sacituzumab govetican and the TROPiCS-04 Phase III trial. Also, we saw data from Dr. Bladder and colleagues in the second-line space from EV201 Phase II study, single-agent Enfortumab Vedotin antibody-drug conjugate against Nectin-4 in patients who had progression on prior checkpoint inhibitor in frontline setting and never received platinum-based chemo for advanced disease. And in this second-line setting in patients who had progression on prior checkpoint inhibitor, Enfortumab Vedotin had an overall response rate of 52%, very impressive in 89 patients in this particular study. Obviously, this is very impressive, 20% complete response rate and 52%, as I mentioned, overall response rate. At the same time, this was a single-arm Phase II study with no randomization, and I think it remains to be seen what the regulatory fate of this agent will be. We don't have any randomized trial data. The overall response rate that I mentioned of 52% seems very high and compares favorably with chemotherapy in the second-line space. But again, we don't have any randomized trial data in this post-immune checkpoint inhibitor second line. And I also want to point out that this population might not be as common because most patients probably get platinum-based chemotherapy in the frontline setting, but definitely exciting data. We saw data from the CheckMate 274 trial with Dr. Bajorin, Dr. Galsky, and others, showing significant disease-free survival benefit with adjuvant Nivolumab versus placebo in the CheckMate 274 adjuvant trial. And the hazard ratio was significant and also even more impressive with patients with PD-L1 high tumors. There's a big debate right now whether the disease-free survival DFS benefit is enough or not to change practice. Many people argue that they want to see overall survival benefit in an adjuvant trial like this. And there is also a question whether disease-free survival will translate or not to overall survival benefit. And I think the jury is still out there, but definitely a very important data set, one of the bigger highlights that we saw at the ASCO GU 2021 at the adjuvant setting of localized, not advanced, localized urothelial cancer in patients who had prior resection of primary tumor, upper tract disease, or bladder cancer, the CheckMate 274 trial. So overall, very exciting meeting. There was also very, very exciting data in the kidney cancer arena. The CLEAR trial by Dr. Bob Moger looking at pembrolizumab, Lenvatinib, and Lenvatinib Everolimus versus Sunitinib in the frontline setting, definitely practicing forming trial, adding another VEGF TKI plus immune checkpoint inhibitor combination in the frontline setting. We have many options there. We have data with Ipi-Nivo, Pembro-Axi, Cabo-Nivo, now Pembro and Lenvatinib. Very interesting. And also very amazing data by Dr. Pal, Sumanta Pal and the SWOG group at the PAPMET SWOG 1500 trial that, in my opinion, changed practice in patients with metastatic papillary renal cell carcinoma, showing that Cabozantinib is probably the standard of care now in patients with papillary RCC metastatic disease based on this randomized trial comparing Cabozantinib with Sunitinib in those patients with this relatively uncommon renal cell carcinoma papillary type. So overall, very exciting data. I didn't cover everything, but I'm very excited about where the field is going in genitourinary cancers. I'm looking forward for more data at ASCO and other meetings in terms of clinical data, better outcomes for patients, and also biomarkers.